Hello, we're back, and in this video lecture, we're going to finish our discussion on coding diseases of the musculoskeletal system. Okay, we left off with what a sequela is. Let's carry on. And we're going to talk about rheumatoid arthritis. Rheumatoid arthritis is a systematic condition that affects multiple joints and surrounding tissues, causes significant inflammation, and leads to long-term joint damage if not treated early. And you can see figures 16.2 through 7 for the joint anatomy. And again, this is something that you can test for with lab tests. You need to have the rheumatoid factor in your blood. Otherwise, it's not usually considered rheumatoid arthritis. Osteoarthritis is, on the other hand, the most common form of degenerative joint condition. It appears more often with age or repeated stress. In coding, you'll need to identify the specific joint involved. This could be the hips, the knees, hands, whatever. And they're different code categories. We also have polyosteoarthritis, which is arthritis of multiple sites. Primary osteoarthritis isn't caused by something else. It's related to aging. We can also have secondary osteoarthritis that develops from trauma or something else. And understanding this will guide us to the correct code. And again, this is all based on the documentation. Now we're going to take a look at some systemic connective tissue diseases. These things involve inflammation or dysfunction throughout the body, not just in the joints. And some examples of this include polyarteritis nodosa, systemic lupus, and Sjogren syndrome. Systemic lupus erythematosus affects multiple organs and tissues and can present with a wide range of symptoms. Excuse me. We also have discoid lupus, which affects mainly the skin. And the coding distinguishes these because they behave very differently clinically. And Sjogren syndrome, truthfully, I have not seen it in a paper or electronic health record. I do know of the codes M35.00 through M35.0C. And this is a systemic autoimmune disorder that it destroys glands of the body that produce tears, saliva, and damages other organ syndromes. Zika syndrome is another term that I have seen once in a while, and it's typically associated with rheumatic disorders. And again, this is one area where you want to pay careful attention to all the documentation, as this will determine the exact correct code. Multisystem inflammatory syndrome, which is seen often in children after COVID exposure, affects several organs at once. And ICD-10-CM includes some specific codes for these. Make sure to capture whether it's involving children or adults. Dorsopathies cover many of the spine-related issues. These include abnormal spinal curves, and these conditions change the posture and can cause chronic pain or mobility limitations. And you can see some examples of these here. Some of these you may know of. We see them often. Scoliosis, kyphosis, and so on. Spondylopathies include disorders that affect the vertebrae themselves, and these could be things from degenerative changes to narrowing of the spinal canal, which compresses nerves and leads to some significant symptoms. Dorsalgia and back pain codes. Back pain codes include nerve-related pain, neck pain, sciatica, and low back pain. Since back pain is one of the more common complaints in healthcare, accurate coding is essential here. And you can see some of these code categories and subcategories here. We also have compartment syndrome. What compartment syndrome means is you have swelling inside a muscle compartment that cuts off circulation. This can be traumatic, say after a crush injury, or non-traumatic. Coding differentiates between these causes, so the documentation detail is very important so we get to the correct code. And the codes even get into the detail about whether it's traumatic, non-traumatic, occurs from swelling from other causes, gets very, very specific. So very important to pay attention. Osteoporosis reduces bone density and it increases the risk of fractures. Codes distinguish between osteoporosis with and without a current fracture, and these codes require a seventh character to show the stage of treatment. And malunion and non-union, we touched on these, but worth reminding again that malunion means that the healing is incorrect. It's misaligned. It's not correctly healing. Non-union is when the two ends, as the orthopedic surgeons would say, the proximal and the distal ends fail to unite. They fail to heal. So that's one of the things that you need to take a look at with that. A lot of times these will require reopening the site and using some sort of internal fixation device, screw, plate, what have you. And again, pathologic and stress fractures, these fall into code subcategories M84 through 83 point M84.3 through M84.6, excuse me. And frequently these codes will require a seventh character. So important to pay attention to these. And finally, we have osteomyelitis. Osteomyelitis is an infection of the bone that affects the metaphyseal area of the long bones. And again, these could be typically the humerus, the long bones, the femur, the legs, vertebrae, tibia, what have you. Usually they are the arms, legs, hands, what have you. And the codes are subdivided whether they're acute, subacute, and chronic. They're fifth and sixth digits that identify the bone that's involved and its laterality. And this is one area where you'll see yet again use additional code to identify the infectious agent, since osteomyelitis is, after all, based on an infection. And that's all I have for you. Thank you for watching, and please reach out if you have any questions about this material. Bye now.